of regenerative medicine in India, they are the pioneers. So before this regenerative medicine, they came into mainstream. They were the one who ventured into this. They invested their own money. They built up a lab. They want to do it in a very regulated way, where they have the cells, they give the patients the indications, the publication, the research. So we want to honor this session with Dr. Ravi sir, where he will be telling about the scope of regenerative medicine, regenerative therapies in testicular rejuvenation. This is very tricky area, because when you speak about giving cells to treat disease of the cells, so many won't accept it. And there's a good saying by Dr. Mahajan sir, like you carry your own repairing kits in your body. So when you give the cells, it homes there, and it does things. So sir will say, and I invite PhD sir to initiate the session by awarding the Orange Medal for sir. After Shankar sir's demise, Vedavali madam, his wife, she is taking care of the whole company, and even she has got multiple fundings with her own efforts. So just want to tell the stage, because she is continuing his passion as his daughter, very famous wife, dentist, and now she's into the field of regenerative medicine, studying at Manipal. So they both are continuing his research and passion. Please, sir.
Thank you, Dr. Natesh. It is really a happy moment to honor our friend, Dr. Shankar Narayan. He was a famous dental surgeon in Trichy. So he was the first person to initiate both Dr. Ramachandran sir and me into this field of regenerative medicine. So more than 10 years ago, he laid the seed of this regenerative medicine in our minds. He created interest in us, and then we started to collaborate, and whatever work we are doing today is definitely because of his initiation. So today I will talk about the regenerative therapies in testicular regeneration, and who should listen to this, why should listen to this. If you are a young doctor, you need this for your practice. If you are old, this I am saying about in general regenerative medicine, not about testicular regeneration. So it is possible to regenerate every tissue in the body. We have regenerated skin, muscle, bone, cartilage. So all the tissues can be regenerated. So if you are an old doctor, you will need this for your own health. If you have a degenerated cartilage, if you have got a torn muscle, ligament, so you will need this for your own health. If you are a young scientist, you need this for your PhD, and if you are an old scientist, you will need for yourself and your family. And before I start, I would like to create one awareness. I want to know how many of you know that whether stem cell therapy is approved in India or not. Many people still think that stem cell therapy is not approved. But the answer is yes, stem cell therapy is already approved in India since 2017. It was in the year 2017 that the first approval for stem cell therapy for Buerger's disease came. So, Buerger's disease, TAO. So, this was there is no treatment available for that, and bone marrow derived stem cells, allogenic stem cells, were first approved for Buerger's disease. I will come to the other approvals later, but before that, we will go for testicular regeneration. So this role of regenerative medicine in non-obstructive azoospermia, which is defined as no sperm in the ejaculate due to failure of spermatogenesis, and which is the most severe form of male infertility, mainly due to intrinsic testicular impairment as well as the inadequate gonadotropin production. And the diagnosis is usually made with history, physical examination, ultrasound examination of the testes, and hormone levels, And then the sperm analysis, which they have been extensively discussed previously. The DNA fragmentation, Y deletions and all. Hormone evaluation and treatment, depending on the existing levels, some men with non-obstructive azoospermia benefit from treatment with certain hormones. The previous speaker, Dr. Gayatri, gave an extensive readout about all the hormones which she has been using. And so the mainstay for treatment, lifestyle modification to correct all the ROS and other things which were discussed, good food, good sleep, exercises, these are the lifestyle modifications recommended, and then the medical treatment, hormone therapy. So when all these things have failed, so what are we left with? After treating the all available methods of technology, so what is available for us to help these patients? So now comes the role of regenerative medicine, that is platelet-rich plasma and stem cells. So platelet-rich plasma is preparing the patient's own blood. You take the venous blood from the patient, and then in the lab you can prepare the platelet-rich plasma. The platelet count should be at least 5 times more than the original count. You should first find out the normal count of the per person, and then after doing our PRP preparation, which involves 4 steps. After collection, there is the first centrifugation with 2000 rpm for 10 minutes, and then after that you remove all the red blood cells, and the remaining portion is again centrifuged to get the platelet-rich plasma in the top, which should contain minimum 5 times the normal platelets. And what is the mechanism of action of platelet-rich plasma? We know platelet contains the alpha granules and the dense granules. So many of the growth factors which are essential for healing are present in the platelets. So when the granules release the growth factors, they help in the process of healing. So fibroblast growth factor, epidermal growth factor, vascular endothelial growth factor, PDGF, that is platelet-derived growth factor, insulin-like growth factor. There are more than 40 growth factors which are essential for healing. And platelet is like a pharmacy. It contains all the growth factors which are needed for healing. And when we have this platelet-rich plasma, it can improve the healing of every tissue. As I said, PRP is being used by multiple specialists for healing multiple tissues. So which are the specialists who are already using PRP? Dermatologists were the first. So today, if you discuss with any dermatologist, they are already doing PRP for hair regeneration and also for skin ulcers. So in orthopedics, we were the second to pick up. So we are doing it for bone regeneration, muscle injuries, tendon partial injuries, partial tear, and cartilage regenerations. PRP is being used for osteoarthritis in cartilage regeneration. Then plastic surgeons have already started using it for ulcers, diabetic ulcers and burns. Again, diabetologists are using it in cases of difficult to heal ulcers. And vascular surgeons, as I told, they are using it for angiogenesis in Buerger's disease, TAO or CL, multiple ulcers. Gynecologists have already started using it. I think many of the gynecologists here know that there are centers where the endometrial regeneration and ovarian regeneration is being, Asherman syndrome and other pathologies are being treated with platelet-rich plasma. Recently, ophthalmologists have joined the bandwagon of platelet-rich plasma. So, in fact, they were the first to use it for cornea. They were already using serum for corneal ulcers. But since last year, Aravind Eye Hospital, they have got a publication where they have injected platelet-rich plasma intravitreal for retinal regeneration. So, every field has started using this PRP wherever they find it difficult to heal the ulcer or treat the problem. But in our town, it was the dental surgeon who first started using this PRP. And Dr. Shankar Narayanan was the first dental surgeon to use it for mucosal regeneration. So regarding sexual medicine, today's the conference is about sexual medicine. So it is time for the specialists of sexual medicine to think about and discuss with all of us, all the specialists who are already using it, and see how we can progress to use PRP for testicular regeneration. And I want to say one slide about the recent ethical guidelines. The only approval body in India for drugs is DCGI. ICMR is only a body for research. It is not a body for approval of any drug or procedure. So the only approval body for the drugs is DCGI. So if you are using autologous blood procedures like PRP or stem cells with minimal manipulation, there is no ethical approval body. Whereas if you are going to use allogenic blood products like allogenic PRP or cultured stem cells, if you are going to take stem cells from somebody else and culture it, it is manufacturing, it is you are manipulating more than minimal manipulation, then you need DCGI approval. This is what I said already, that the DCGI has already approved stem cells. These are the products. Regenerative is for vascular regeneration, STEM 1 is osteoarthritis. 2022 already the osteoarthritis stem cell therapy product is out. And these two are products from Cipla for hair regeneration and skin regeneration. So these are the approval letters. Because many people still think stem cell therapy is not approved. So this is the proof which I wanted to show, that the company Therapies is involved in all the three. All the three products are from the same company, Therapies. For CLI-TAO it was 2017. You can see the year 2017. For 2020 for the CLI and peripheral arterial disease, and for osteoarthritis the approval was given in February 2022. Now we are coming to the mechanism of action of PRP in non-obstructive azoospermia. It was the work of Dr. Deepa Bhartiya in the Mumbai Fertility Center. She showed that multipotent stem cells are present in the testis, spermatogonial stem cells, as well as the presence of very small embryonic-like stem cells which are present in the testis. These cells resist all damage caused by chemotherapy, radiotherapy. They are capable of surviving all the damage, and they can start producing the sperm cells again. So these spermatogonial stem cells, which are very sensitive to chemotherapy, radiotherapy, toxins, viruses, and they lead to the male infertility. And platelet-rich plasma with all its rich growth factors, it has been proven beneficial in regeneration of these particular spermatogonial stem cells. And it has been reported to reduce the oxidative stress. So we have been discussing about the oxidative stress and the reactive oxygen species generation. And PRP can upregulate the expression of various antioxidant enzymes, and it will improve the mitochondrial function and promote angiogenesis in the testes and reverse the fibrosis. So the mechanism of action, today we are discussing with Dr. Narendra Pal, how does this platelet-rich plasma or stem cell therapy help in this process of testicular regeneration. So it is by reducing the oxidative stress, it is by upregulating the expression of the various antioxidant enzymes, and it also helps in improving the mitochondrial function. The property of stem cells is to release the growth factors as well as other components in a paracrine manner. When we inject stem cells, the stem cells release certain things. Some of them are found in the cytoplasm, some of them are found in the nucleus. And the most important is they release mitochondria. They release ATP. They release calcium. So all these are released by the stem cells, which are taken up by the defective cells, whether it is the sperm or whether it is the hair follicle or whether it is in the skin fibroblast when they refuse to heal. So when these mitochondria, it donates the mitochondria, it donates ATP, it donates the calcium. So it improves the mitochondrial function, and as all of you know, that is very important for sperm, the mitochondrial function. So there have been some animal studies, mice study, where they studied the injection of stem cells into the testes, and even after 12 weeks of injection, the stem cells remain in the testes. How long will the stem cells remain in an injected area? If you inject into a joint, if you inject into testes, if you inject into the heart, if you inject into any organ, how long do these stem cells last? So here they have shown that even 12 weeks after transplantation, the stem cells were found surviving in the transplanted testes. And they have shown that how it works is by improving the Sertoli cell as well as the Leydig cell number as well as the function. So under favorable testicular condition, the bone marrow stem cells can differentiate into the somatic cell as well as the germ cells, which is the Sertoli cells and the Leydig cells. And the recipient neighborhood in the recipient testis may control site-specific or site-appropriate stem cell differentiation. There have been human studies also about injecting bone marrow stem cells into the testis in cases of oligospermia and azoospermia. So this is a study from Jordan Farah Hospital where they did 60 cases, out of which 20 was oligospermic and 10 cases were azoospermic. And on outcomes, they found that the significant increase in number of the sperms on 3 successive semen samples assessed after 1, 2 and 3 months of injection. So how do we prepare the stem cells? So this is the protocol where we remove the stem cells from the iliac crest. It is removed, we can do it in a supine position or in the prone position. We can take from anterior superior spine or posterior superior spine. So we aspirate from the iliac crest and then it is processed in a machine. It is a lab which separates the stem cells by process of centrifugation, and then that can be injected into the testis. It was done by Dr. Rajendran, our senior urologist, for our cases, where he used to palpate, after assessment, he used to palpate the testis and inject it in multiple places. Every time he injects 0.5 ml and then makes sure that it doesn't become too much turgid. The future sources of stem cells. So we have taken stem cells from bone marrow, but we can also take stem cells from the fat. So fat is also a rich source of stem cells. Within 45 minutes, we can separate stem cells from bone marrow, but for fat, it will take minimum 3 hours. So fat, dental pulp, and the umbilical cord, there are also other good sources of stem cells. Menstrual blood derived stem cells are also useful. Already there are a lot of clinical trials going on. I just showed the Jordan study for the testicular regeneration, but in infertility, other aspects like ovarian regeneration, uterine regeneration, erectile dysfunction, there are a number of clinical trials, but they are in stages of phase 1 and phase 2 and not reported to have completed the trial. So what I would suggest is, we should, whoever we are assembled in this hall, we should discuss among ourselves and we can take the route of platelet-rich plasma first. Instead of taking stem cells first, we can take platelet-rich plasma first and we can do intratesticular injection. As I told you, for doing autologous platelet-rich plasma, we are taking patient's own blood, we are separating the platelet-rich plasma and we are injecting it back to the patient. This is minimal manipulation. It does not require any approval from BCGI. So this can be done by our own. It is a relation between the patient and the doctor. So we can start with this PRP. Stem cells contain 6 times more growth factors than PRP. So we will start with PRP and later, after we find out the proper indications, proper protocol, then we can move on to stem cells. Stem cells are, as I told, available nowadays. So we can use available stem cells as off-label. Off-label use of drugs is allowed. it is legal, it is ethical. All the drugs which we used in COVID were off-label. None of the drug which we used in COVID was approved for COVID. They were all approved for different indications, but we used them for COVID. Many drugs which we prescribe today in our prescription, they are off-label. We are using methotrexate, it's an anti-cancer drug for rheumatoid arthritis. Gynecologists are using it for molar pregnancy. So many of the gabapentin, GABA drugs, they are the hot cakes of today, but they are for neuropathy. Everybody is prescribing gabapentins, but they are anti-epileptics. They are originally anti-epileptics. Now they are being used as off-label. So we can use the approved stem cells as off-label into the testis. So that is ethical, that is approved. So this is the way I think we can go forward. We already see there are a lot of trials going on for multiple indications in infertility, but how we can proceed this should be our protocol. Why should we do PRP stem cell therapy? Because of the limited success of TSE and ICSI. So in first TSE cycle, only 50% patients have sperms. Subsequent probability of fertilization with ICSI is 50%. So with the 2 steps, successful fertilization possibility is 13.4. This I picked up from the literature. As I told, endometrial regeneration has already been studied again with stem cells. Dr. Nagori and Himanshu Patel, they did a study long time back for endometrial regeneration in Asherman syndrome using stem cells, injecting stem cells into the endometrium. And they found out that the endometrial fibrosis was reversed and a shortage of stem cells in the endometrial basalis has been recognized as the common cause of IUA development, because approximately 90% of patients suffer from intrauterine adhesions after endometrial injury, and the stem cell therapy can reverse the fibrosis. Again, please mark the word reverse the fibrosis. In allopathy, we have never reversed any fibrosis. Fibrosis we can reverse only with regenerative therapy. None of the drugs can reverse fibrosis. So in essence, we can get the sperm from the testis, we can get the sperm from the lab also. So it is possible to grow the stem cells into an induced pluripotent stem cell, and from the induced pluripotent stem cell, we can get a sperm. So without the involvement of testis, we can get sperm in the lab. But that is too much in the future. We will discuss it about later. But it is possible and people have already done that. Finally, coming to the stem cell, as I told, there are products which are available. Cipla, this is the Regenerative is for ulcers, non-healing ulcer with vascular blockade. It is 150 million stem cells and 200 million stem cells available as a packet. It comes in a pouch. They send the stem cells in a liquid nitrogen tank. Suppose a person has got ulcer, you want to use the stem cells. Or suppose a person has got osteoarthritis. Any Indian doctor who wants to use stem cells for osteoarthritis, you give a prescription for stem cells, it goes to the pharmacy. From the pharmacy, they order to Alchem. And then within 3 days, these stem cells come in a liquid nitrogen tank. The manufacturing is done in Manipal. So throughout India, from Manipal, the stem cells are sent in liquid nitrogen tank. It will take minimum 3 days, 4 days. After that, you can call the patient, take the stem cells out of the liquid nitrogen tank, and then you can thaw it for 30 minutes. They give the warm bath also. So you thaw it and then you can inject it. So this is the product and these are the costs of stem cell therapy in India. India is the only country in the world where all these 6 therapies are approved. Finally, as I told you in the beginning, we have regenerated every tissue in the body. It is possible to regenerate every tissue in the body. This is hair regeneration with PRP. This is big ulcer regenerated. And this is endometrial regeneration, where you can see not only the thickness of the endometrium, but also with Doppler you can see that there is increase in the vascularity, because it is not only the thickness which should improve, but it should also increase in the vascularity, angiogenesis, which will help in regeneration. So again, testicular regeneration from oligospermia, we have done some of our cases where we increase the number. As I said, it is not only increase in the number of testes, it is also the increase in the motility of the sperms. So this is mucosal regeneration, a condition called oral submucous fibrosis. Patient takes Panpara and then their mouth becomes trismus, so they are not able to open the mouth. The mucosa is like plastered, it is plastered and fibrotic, and we have injected and reversed the fibrosis. We have reversed the fibrosis and got back not only mouth opening but also putting out the tongue. And this is the proof of the reversal of mucosa, histopathological proof, where you can see this is the matted collagen and this wavy pattern is normal collagen. In fibrosis, the collagen will be matted. When fibrosis is reversed, you will get the wavy pattern of collagen. So, not only reversal of fibrosis, but you can see small blood vessels, which is a proof of angiogenesis. So, this is the piece of work done by my friend Dr. Shankar Narayan, who proved that reversal of fibrosis. The only other people who have reversed fibrosis is ophthalmologists. So, they have already proved in cornea, when a person has got a corneal fibrosis due to acid injury, alkali injury on one eye, they take stem cells, and this is the first FDA approved skin 3D printing. All this I am mentioning to just show that the future ahead is very, very bright, and unless we all indulge in these future technologies, we can definitely give better results to our patients. Thank you. Thank you very much.
Thank you, Dr. Ravi, for the thought-provoking session. I now request the chairpersons, Dr. P. Ramachandran and Mrs. Vedivali, to facilitate our speaker. I now request our speaker to facilitate our chairpersons. I would take a minute also to thank the team staff, and special thanks to Dr. Natesh Prabhu sir for organizing an oration on my father. It's really, really special because he had his dream to make Trichy the hub of regenerative medicine. That was his dream, and it's after his demise, it's been happening. We are able to see a very bright future, and you could see that from the presentation of Dr. Ravi. And it's really, really special for me to see such a memorable event in my hometown here. So thank you so much.